Hey guys, Dr. Bonnie here, and today I want to talk to you guys about why do babies get adjusted. And it starts off with birthing trauma. So what do I mean by birthing trauma? There's C-sections, the use of forceps or vacuums to extract the baby, but also pulling or twisting on the head to deliver the infant's body into the world. There's also labor time, whether it's short or whether it's long, it does play a role in the birthing process, but also the use of Pitocin to strengthen and induce uterine contractions. So when it comes down to the conditions that we see here in our office, I want to talk about the top 10 conditions that you'll see and why babies need to get adjusted. The first condition is latching or nursing problems. So you'll see that the baby prefers one side more than the other. It's due to kinetic imbalance due to suboccipital strain, which means that their head is on one side. So that's where you'll see the baby's presentation if they prefer one more than the other. The mom may also report discomfort into the breast. They also, again, baby nurses on one side or that doesn't latch at all, or if the mom does not produce enough milk. So that's why it's important always to get the babies checked if you are having any of these issues. The second condition that you might see is if the baby has colic, GI, or refluxes. And so common presentations, you'll see a baby is clenching their fat fist, if they have their knees drawn up to their chest, they have a red face, there's excessive crying, it's high-pitched crying. And so this is more for the mom, because if you are breastfeeding, of course, the nutrients that you put into your body gets passed on to the baby. So you gotta ask yourself, all right, am I eating dairy? Am I eating spicy food, beans, cruciferous vegetables? Sugar and gluten are less common, but it is possible. Now, when a baby starts to have colic symptoms, it doesn't start right away. It starts about week 3 or 6. And if you are having issues, mom, with breastfeeding and the baby's feeling that way, you might think about changing and going into a organic formula. Here's a presentation that you might see is spitting up. So you'll see if there is a happy baby and then not a happy baby. The next one that you might see too here is the belly presentation. Are they a gassy belly or are they a happy belly? The next condition you'll see is ear infections. Typically, will start around when the kid is around 6 years old. And so you do want to evaluate the C-spine, because if there is any pressure on the C1 and C2 vertebra, that can indicate what's going on. So our job as a chiropractor is help to release the pressure on the eustachian tube, allowing the ears to drain out naturally, but also looking at the temporal bones. So if this leaves untreated, this could lead to potential hearing loss in kids. The next condition is asthma and allergies. Research has shown if a kid uses antibiotics before their first birthday, they do have an increase for asthma and allergies. So when it comes down to it, you have to look at how the body functions. And so you have your C-spine, which is your first line of immune defense, because it controls your eyes, your ears, your nose, your throat, your glands. You have your T-spine that controls your respiratory system, your L-spine that controls your digestive system. And also when the baby is born, you do want to have a natural delivery because this exposes the baby to good bacteria. Now, getting adjusted, that's why we adjust the C-spine and the T-spine to allow the body to function better, for the lungs to breathe better, but also for your immune system to work a lot stronger. The next condition you'll see is neurodevelopment disorders. So 90% of brain stimulation actually comes from movement of the spine. And so for kids, research was shown, kids who were riding horses and doing the pelvic girdle movements, going pelvic rocking back and forth, side to side, and doing a figure 8 motion, it was shown that it actually helped improve their learning disability with kids with ADD and ADHD, which is why in our clinic, you'll see that we have these wobble cushions, guys. These wobble cushions not only help warm up our spine and give nutrients and hydrate the disc, but the motion that we do actually mimics the things on the horses to help improve learning disability. Colds and a fever. So when the baby has a fever, their temperature spikes. but this is okay because it's our natural response to actually help fight off the bacteria or the virus, because your body can't, because they can't live in that environment. So what you do is just support the fever. Take a hot bath, wear 2 pairs of socks, and of course get adjusted, because research shows that chiropractic care helps support the immune system by 200%. Now, headaches are caused due to the lack of oxygen or blood supply to your brain. The upper C spine actually has the blood supply that controls that area. So you want to do is relieve the pressure off of there. That's why they get adjusted, but also want to make sure the kids are hydrated, getting enough hydration and fluids into their system, and also making sure that their vision is good. So have them pick out a favorite book or maybe locate something on that page. The last one we see is sport injuries. So many kids play sports, and the number one you'll see is concussions, because there's a lot of head-to-head contact. Now, when it comes down to nerve interference in our body, 97% of nerve interference is actually due to repetitive stress. So doing things over and over, day in and day out, just like playing sports, because you do it every day in practice. And that's why it's good to get adjusted, just to make sure the body is feeling better, but also make sure the body is functioning better. That is the top 10 conditions on why babies and kids get adjusted. Now, it's definitely absolutely safe for kids to get adjusted. We do use a safe, gentle technique and very light pressure. Amount of pressure that you use of pushing onto your eyelid. All of our doctors are trained in treating kids. So get your kids adjusted and make sure that we start to actually build healthy kids instead of fixing injured adults.